In the doctor's office, the patient's blood oxygen saturation is measured with pulse oximeter. Which of the following is a source of vitamin C? Citrus fruits. Principles of professional ethics may include all of the following except financial control. Which type of drug schedule has no acceptable medical use? Schedule I. A medical assistant scheduled to remove stitches from a patient's arm noticed that the area WA is red, swollen, and painful upon the slightest touch. The patient requested to see the physician and was reluctant to let the medical assistant remove the sutures. The attribute important in dealing with this situation is flexibility. Which of the following terms means incision in the muscle? Myotomy. Which of the following is a written description of work experiences, skills, and educational background? Resume. What is the term for the visual examination of the vagina and cervix? Colposcopy. Which of the following would be an example of personal accountability? Admitting to an error made. Two rescuers are performing CPR on a 9-year-old child who collapsed and is not breathing. Which of the following actions should the rescuers take? Attach the AED and follow the voice prompts. The RMA certification is maintained by earning 45 CEUs within 3 years or 15 CEUs per year. Which of the following identifies the components that are central to Sigmund Freud's theories of personality? ID, ego, superego. Which of the following pulses is auscultated with a stethoscope? Apical. Demographic information to be included in the patient's record includes name, address, and telephone number. Which of the following questions is considered legal when conducting a job interview of a prospective employee? Are you authorized to work in the United States? How often should quality control be performed for laboratory procedures? Daily. In a normal blood cell differential, what is the total number of cells counted? 100. The basic parts of the communication process include message, sender, receiver, channels, feedback. A capillary puncture is most likely to be performed on the outer edges of the plantar surface of the heel in which of the following patients? A 10-month-old infant. Which of the following attributes refers to the ability to understand someone else's feeling or situations? Empathy. Which of the following terms describes nearsightedness? Myopia. The process of cleaning and removing debris from instruments is known as sanitization. Which of the following is the best source of fiber? Raw vegetables. A clear liquid diet consists of all of the following except milk. All of the following may interfere with impartiality of the treatment of patients except diplomacy is skill in managing negotiations, handling people, etc., so that there is little or no ill will. Tact. Dosages for children are most frequently calculated according to body weight. The study of body language is called kinesiology. Which of the following terms means inflammation of a vein? Phlebitis. A procedure to screen for breast cancer is known as which of the following? Mammography. Before transferring a call to another extension, which of the following is the most appropriate for the medical assistant to do? Give the patient the extension number to which he or she is being transferred in case the phone gets disconnected. Incoming calls should be answered, ideally by the first ring and definitely by the third ring. When a responsive adult agrees to receive first aid care, it is known as express consent. When receiving a call from an angry patient, the medical assistant should stay calm and listen to the patient. Screening or triaging incoming calls is a method of prioritizing the urgency of calls. Which of the following is included in a patient's vital signs? Respiration rate. When communicating with a hearing-impaired patient, the medical assistant should do all of the following except Tape all conversations for later review by the patient. The medical assistant is performing a venipuncture and has just filled the last specimen tube. Which of the following should the medical assistant do before withdrawing the needle? Release the tourniquet. All of the following statements about treating children are true except children should not be told the truth about a procedure to be done because it may frighten them. When communicating with an illiterate patient, the medical assistant may use oral explanations and directions. Which of the following best describes the location of hypochondriac region of the body? Below the ribs. Which of the following techniques is used to protect the patient from exposure to outside pathogens during minor surgery? Asepsis. Which of the following organizations developed the guidelines for standard precautions? CDC Centers for Disease Control and Prevention. Which of the following instruments is used to look into the ears? Otoscope. Which of the following vitamins aids in blood clotting? Vitamin K. Evaluating the effectiveness of communication may be done by using feedback. Which of the following is the section of a prescription with instructions to the patient on how to take the prescribed medication? Signature. Which form, when signed by a patient, allows a representative to act as a healthcare agent for a patient? Durable power of attorney. Which term means vomiting blood? Hematemesis. All of the following events are reportable by the physician except hypertension. Which of the following combining forms is matched correctly with the meaning? Puri equals around. Which of the following is a term used to describe the improper release of confidential information? Invasion of privacy. A medical assistant who continually asks to leave work early for personal reasons is lacking the quality of dependability. Triage involves assigning degrees of urgency to triage does not diagnose the patient's condition. An automated external defibrillator delivers a electric shock. Which of the following describes a lawful act performed improperly by a physician? Misfeasance. Which of the following terms describes untrue oral statements made to damage an individual's reputation? Slander. Which of the following instruments is used by the physician to determine the presence or absence of bell sounds? Stethoscope. The Occupational Safety and Health Act was legislation passed to ensure all of the following except legal assistance to employers being sued. All of the following accommodations may be made to comply with the regulations recommended in the Americans with Disabilities Act except inquiring about the mobility devices a patient uses to see whether the office can accommodate them. All of the following statements are true about the Medical Practice Acts except a medical assistant may have his or her license revoked for performing certain tasks. Which of the following contains the genetic material of the cell? Nucleus, a dense organelle present in most eukaryotic cells, typically a single rounded structure bounded by a double membrane containing the genetic material. The three types of muscle tissue are skeletal, smooth, and cardiac. Smooth muscles are composed of elongated, spindle-shaped cells and are commonly involved in involuntary motions. Skeletal muscles allow movement by being attached to bones in the body. Skeletal muscles control voluntary movements. The myocardium is the name of heart muscle. Cardiac muscles work involuntarily to pump blood. Which of the following describes the purpose of monitoring autoclaves with sport tests? To ensure that an autoclave is sterilizing instruments properly. The process by which nutrients leave the gastrointestinal system and enter the bloodstream is called absorption. When a blood pressure cuff is deflated, the first tapping sound is the systolic pressure. The Good Samaritan law protects an individual who performs first aid voluntarily on an injured person. Which of the following classes of drugs is administered as a cleansing preparation before performing a radiologic study of the intestinal tract? Cathartics. An advance directive allows an individual to describe in detail wishes for end-of-life care and allows a durable power of attorney for healthcare to be selected. Which suffix means pain? Algia. Which term is used to mean ordering an individual to appear in court and to bring any papers, books, or information necessary to explain an issue? Subpoena ducis tecum. Which of the following is the study and treatment of the colon, rectum, and anus? Proctology. All of the following information about the W-4 form used by the Internal Revenue Service is true except it may be changed only once a year, which is not an approved right in the patient's Bill of Rights. Right to refunds for complications that arise during hospital stays. The medical assistant is attending to a responsive child injured in a bicycle accident. He has a sharp pain and swelling in the right leg, which looks strangely bent. Emergency medical service has been alerted. The medical assistant should manually stabilize the injured leg. Term describes legal techniques used to resolve disputes between parties, such as a physician and a patient, without going to court is arbitration. Arbitration is the submission of a dispute to one or more impartial persons for a final and binding decision known as an award. Contributory negligence tries to show that the plaintiff is partially responsible for the injury or complication. A patient comes to the office and says, "I have pain in the right lower side of my abdomen." This is an example of which component of the patient's history? Chief complaint. During a spirometry, how many good efforts at inhaling deeply and exhaling must a patient make to ensure an accurate measurement? 3. Which of the following is a screening test for tuberculosis? The tuberculosis skin test, sometimes called MAN2, is a simple, harmless way to find out if you have latent TB infection. An example of an emancipated minor is a 17-year-old married female. All of the following are techniques for active listening except stating opinions and interjecting questions to ensure clear understanding of the message. Which of the following terms means nosebleed? Epistaxis. Dysmenorrhea means pain during menstruation/periods. A healthcare professional should wear a face shield for protection when performing which of the following tasks? Inoculating a culture plate. Eating contaminated food is an example of which of the following links in the chain of infection? Portal of entry. A patient with high cholesterol should be instructed to avoid intake of which of the following? Red meat. Which of the following thermometers would be used when taking a temperature via the ear canal? Tympanic. Workers' compensation is a law that covers all of the following except an employee who suffers from lung damage because of prolonged exposure to hazardous chemical while remodeling his or her home. The most appropriate step immediately after administering a subcutaneous injection is to massage the injection site. Which type of letter formatting aligns all lines with the left margin of the paper except for the date line, complementary closing line, and signature line? Modified block. Which suffix means fixation? Pexy. Which of the following items would not be included when preparing minutes of a meeting? Schedule of all past and future meetings. The root word enter refers to which of the following? Intestines. Data processing involves all of the following except repairing computer equipment. Which part of the computer is responsible for allowing the computer to perform all operations? Central processing unit. Which of the following is the universal sign that a person is choking? Clutching the neck. Which of the following is the abbreviation for the medical term for a stroke? CVA. Cerebrovascular accident is damage to the brain from interruption of its blood supply. Data storage devices include all of the following except CPU. All of the following statements about computer software are true except computer software consists of a modem and a printer. The circumference of the head should be measured during regular checkups until a pediatric patient reaches which of the following ages? 36 months. Which of the following is an advantage of the electronic medical record? Available quickly in emergency situations. Before drawing blood for a lipid profile, the patient must be instructed to fast for how many hours before the test? 12-14. A paper medical record should be corrected by which of the following methods? Draw a single line through the air with red ink. Write the correction, initial, and date. One concept that is central in cognitive theory is irrational beliefs. In a filing system, the release mark indicates, usually by the physician's initials or signature, that the item has been seen and read by the physician and is ready to file. The endocrine system is responsible for regulating the body's metabolic activities. Which of the following is the abnormal outward curvature of the spine? Kyphosis. Which of the following words or phrases means all of the factors required for infectious disease to spread? Chain of infection. Which of the following is not considered appropriate barrier protection? Prescription eyeglasses. The primary source of energy in food comes from which of the following? Carbohydrates. Knowing how to index or order names is necessary in deciding where to place a file in an alphabetical filing system. Which of the following names an index correctly? Arnold J. Smith-Jones, Smith-Jones Arnold J. Lidocaine and procaine are examples of anesthetics. Which term refers to a record of picture of a blood vessel? Angiogram. An angiogram is an X-ray test that uses a special dye and camera to take pictures of the blood flow in an artery. The advantages of postage meters include all of the following except that they are disposable. Which of the following terms refers to the cessation of menstruation? Menopause is a natural decline in reproductive hormones when a woman reaches her 40s or 50s. Notations on envelopes such as special delivery or certified would be typed directly below the stamp. Characteristics of a first-degree burn include reddened skin. All of the statements about special delivery mail are true except it offers proof of delivery. Which of the following procedures should be used when a letter addressed to another medical office is opened in error? Reseal the envelope, write opened in error, and then mail it again. The lithotomy position is used for patients in which circumstance? Needing a cervical exam. The position is perhaps most recognizable as the often used position for childbirth. The patient is laid on the back with knees bent, positioned above the hips. The approved USPS state abbreviation for Minnesota is MN. Test for occult blood in the stool should be performed after a patient has been on a 3-day diet that is free from which of the following? Red meat, In which manner is a letter to be handled when it will be mailed in a window envelope? The letter is folded in thirds by fan folding the letter with the name and address fitting into the window. Which of the following situations should be recorded in the patient's medical record? An established patient cancels an appointment. Which of the following is the largest organ in the body? Skin. Anatomy is the study of the structures of the body. Each of the following is a method of sterilization to achieve surgical asepsis except microwaving. Patients that need to follow a low-sodium diet include all the following except a patient with diabetes. Which of the following would be appropriate when setting up the matrix in an appointment book? Placing an X through vacation days in pencil. The physician orders a buccal medication. The medical assistant should instruct the patient to place the medication between the lower teeth and cheek. These medications can come in the form of tablets, films, or sprays. The type of scheduling style that assigns a specific time for each patient throughout the day is called stream. Which of the following suffixes means following? Foggia. Which of the following is not a government-sponsored healthcare insurance plan? Blue Cross Blue Shield. If a provider accepts assignment on a Medicare claim, this means that the insurance payment will be sent to the medical office. Coordination of benefits is used by insurance carriers to avoid duplication of payments for the same service or procedure. When rendering first aid to a choking infant, all of the following may be performed except abdominal thrusts. Which of the following checks has a step attached to the check for recording information about the transaction? Voucher check. Which of the following checks is the patient's personal check? Certified check. What piece of equipment is helpful during a physical exam to determine hearing? Tuning fork for the Weber test. The test is named after Ernst Heinrich Weber. If the patient has a history of returned checks for non-sufficient funds, the medical assistant may accept all of the following types of checks except personal check. Which of the following is the most appropriate method to obtain a sputum specimen? Have the patient cough deeply and expel the material into a sterile container. Insurance policies that require policyholders to seek medical care from preferred providers only are called managed care policies. Policies that are supplementary to Medicare insurance are known as Medigap policies. Epithelial tissue covers all of the following except cartilage. Epithelial tissue covers surfaces, lines cavities, forms glands. What term indicates a hold in the lining of the stomach? Peptic ulcer. Peptic ulcer disease refers to painful sores or ulcers in the lining of the stomach or first part of the small intestine, called the duodenum. Medicare claims are handled in the state or region by a fiscal intermediary. A fiscal intermediary is a private company contracted by Medicare to pay bills, such as hospital expenses, for Medicare Part A and Part B. An idiosyncratic effect is any unintended effect on the body as a result of the use of therapeutic drugs, drugs of abuse, or the interaction of two or more pharmacologically active agents. Why is it important for the medical assistant to understand medical insurance coding? Insurance coding is needed to file patient claims in order to receive reimbursement from insurance carriers. The medical specialty study of and treatment of diseases and disorders or the urinary tract is urology. The International Classification of Diseases ICD 9 cm coding book was compiled by World Health Organization WHO. Which of the following is required insurance form for government-run programs such as Medicare and Medicaid? CMS 1500. The CMS 1500 form is the official standard Medicare and Medicaid health insurance claim form required by the Centers for Medicare and Medicaid Services, which prefix means inside. Endo. All of the following are reasons that an insurance carrier may reject a claim except the 5-digit CPT code matches the appropriate diagnosis. The first aid priority for an injured victim is to make sure a patent or cleared airway exists. The most common insurance form used in the medical office is CMS 1500. Of the following choices, which is the most important point to remember when completing an insurance claim form? To check each carrier's regulations. Measuring the circumference of an infant's head is an example of mensuration, measurement, theory of measurement. Which item may be used to check a patient's insurance eligibility? A POS device. A point-of-sale terminal is an electronic device that is used for verifying and processing credit card transactions. The lifespan of a human red blood cell is 120 days. Collection of fees when a patient has died may be directed to the executor of the estate. Which of the following body fats is protective against cardiovascular disease? High-density lipoprotein. A statement for an overdue bill should no longer be sent to a patient when the patient declares bankruptcy. The inguinal region is lower lateral groin region, located on the lower portion of the anterior abdominal wall, with the thigh inferiorly, the pubic tubercle medially, and the anterior superior iliac spine. Which of the following will result if a physician fails to assign a diagnostic code for an insurance claim? The insurance claim will be rejected. Calculate the following drug dosage. The physician orders 750 mg of ciprofloxacin. The label of the bottle in the office says 250 mg per tablet. 3 tablets. The combining form PULMONO refers to the lungs. An assignment of benefits signature by the patient gives the insurance company authorization to do which of the following? Pay the benefits directly to the physician. A parenteral drug is injected/taken into the body or administered in a manner other than through the digestive tract, as by intravenous or intramuscular injection. When a new patient claims coverage under Medicare, the medical assistant in a medical office should check the patient's Medicare card to be sure that it includes Part B. Which of the following terms means abnormal inflammation of the liver? Hepatitis. All of the following statements are true for the Uniform Anatomical Gift Law (EXCPT). All organs, regardless of their condition, may be donated. In human behavior, defense mechanisms include all of the following except substitution. Which of the following is a proper technique for disposing of biohazardous waste? Placing contaminated gloves in a plastic biohazard bag. The yearly amount a patient must pay before an insurance carrier reimburses medical expenses is called a deductible. When a patient is suffering from insulin shock, administer sugar/call 911, particularly if the person is unconscious. Get sugar into the body immediately, as outlined above. Administer an injection of glucagon if the person is unconscious, if you have it. If you don't have glucagon, emergency personnel will have some. Do not give an unconscious person something to swallow, as they may choke on it. The term used to describe the sharing of medical expenses between the patient and the insurance carrier, with a patient paying a percentage of the bill, is called a copay. All of the following statements are true for the Uniform Anatomical Gift Law (EXCPT). All organs, regardless of their condition, may be donated. In which of the following positions should the patient be placed for an abdominal examination? Supine. Which of the following is the medical term for bruise? Contusion. All of the following are ways for a medical assistant to protect confidential information on a computer from unauthorized personnel except share password only with medical personnel. Why would a medical assistant use the Z-track method to administer a drug? The drug needs to be deep intramuscular and can stain or irritate the subcutaneous tissue. The pegboard system is also referred to as the write it once or one write system. A minor wound includes all of the following except open fracture. Aging of accounts should be done for which of the following reasons? To determine the amount a patient owes on a bill and for how long. The prefix tachi means which of the following? Fast. The combining form pulmono refers to the lungs. Which of the following describes the antagonism effect? Two drugs working in opposition to each other / antagonism is a phenomenon wherein two or more agents in combination have an overall effect that is less than the sum of their individual effects. The amount of air remaining in the lungs after normal expiration is called the functional residual capacity. How often should equipment and instruments be checked to ensure that they are working properly? Daily. When a physician orders nebulizer treatment, the administration of the drug is through which process or route? Inhalation. One of the primary functions of vitamin D is to support bone development. If an ECG recording appears as a series of small uniform spikes in the baseline, the medical assistant should check for nearby electric appliances. Which of the following practices ensures the most effective restocking of supplies? Keeping a list of inventory and noting diminishing supplies. Lead eye of the electrocardiograph transmits and records electrical activity between which of the following limbs? Right arm and left arm. How much water is recommended to be consumed in a 24-hour period? 8 8-ounce glasses. Which of the following is used in the autoclave for sterilization of package instruments? Distilled water. In approximately how many hours will a plaster cast be completely dry? 72. Which of the following is a device used when full weight cannot be placed on an injured area? Crutches. Which of the following is an instrument that measures a person's ability to hear variations in sound intensity and pitch? Audiometer. A patient states that he has had no digestive problems. This statement should be recorded in which of the following parts of the patient's medical record? Review of systems. Element. The simplest form of matter with unique chemical properties. Oxygen, iron, gold, and other elements cannot be broken down into different substances by ordinary chemical means. All matter, living and non-living, is composed of elements. Atom. The smallest particle of an element consisting of electrons surrounding a nucleus composed of protons, neutrons, and other entities. Atomic number. The number of protons in the nucleus of the atom. The hydrogen atom, for example, has 1 proton and its atomic number is 1. Carbon has 6 protons and its atomic number is 6. Atomic weight. The relative weight of an atom, determined by the number of protons and neutrons together and compared with the standard carbon atom. Ionic bond. A relatively weak attraction formed when one or more electrons are transferred from one atom to another. It is easily disrupted in water. Covalent bond. The chemical bond formed when two atoms share a pair of electrons. It is the strongest type of chemical bond. Ion. An atom that has acquired a charge through the gain or loss of one or more electrons. Anion. A negatively charged atom. Cation. A positively charged atom. Compound. A molecule composed of two or more different elements, such as carbon dioxide. Mixture. A combination of substances that are not chemically combined and can be separated by physical means. Suspension. A mixture in which a solid is distributed but not dissolved. It will separate unless it is shaken. Electrolyte. A substance that permits the transfer of electrons in solution. Common electrolytes include acids, bases, and salts. Telephone. The number used to indicate the exact strength of an acid or base. pH scale. A scale ranging from 0 to 14 that measures the hydrogen ion concentration of a solution. Acids. A substance with a pH less than 7.0 that ionizes in water to release hydrogen ions. A hydrogen ion consists of a proton. An acid is referred to as a hydrogen ion donor or a protein donor. Base. A substance with a pH greater than 7.0. It is referred to as a hydrogen ion acceptor or a proton acceptor. Bases contain higher concentration of hydroxyl ions, whereas acids contain higher concentrations of hydrogen ions. Buffer. A substance that prevents or reduces changes in pH and counterbalances the addition of an acid or base. Buffer system. A system that uses chemical reactions occurring in the body fluids to maintain a particular telephone. The acid-base balance is regulated by two buffer systems in the body, the lungs and the kidneys. ATP. The primary provider of energy for a cell. Adenosine triphosphate. Neutral. A pH between 6.5 and 7.5, which is close to the pH of pure water. Largest bone in the body. Femur. Example of a ball and socket joint. Hip. When a muscle contracts, it becomes shorter and thicker. Growth hormone is produced in the pituitary gland. The function of insulin is to assist glucose into the cells. The cavity within the kidney that collects urine is a renal pelvis. The kidneys are located behind the peritoneum. The site of fertilization is usually the fallopian tube. Sperm and egg cell maturity begin at puberty. What are the three sections of the small intestine? Duodenum, jejunum, ileum. The internal folds of the stomach are known as rugae. The vitamin produced by the normal flora of the colon in amount sufficient to meet a person's daily need is vitamin K. A nerve impulse is carried across a synapse by neurotransmitter. The gray matter on the surface of the cerebral hemispheres is called the cerebral cortex. During swallowing, the larynx is covered by the epiglottis. The part of the pharynx that is a passageway for air only is the nasopharynx. The left ventricle of the heart sends blood out through which artery? Aorta. The outermost of the pericardial membranes is the fibrous pericardium. The protein in epidermal cells that makes the skin relatively waterproof is keratin. The outer layer of the skin is the epidermis. The receptors for hearing and equilibrium are located in the inner ear. The thin membrane that lines the eyelids and covers the white of the eye is a Conjunctiva. The abnormal lateral curvature of the spine that is often congenital in origin is scoliosis. A type of bone fracture producing many bone fragments is comminuted fracture. An abnormal scar formation is keloid. Bilirubin specimens require what special preparation? Protection from light. A genetic disorder characterized by the inability of the blood to clot properly is hemophilia. Night blindness may be caused by a deficiency of vitamin A. Deficiency of vitamin B12 leads to which type of anemia? Pernicious. The most common eye condition associated with aging. Presbyopia. The combining form that means red is ERYTHRO. The combining form that means tissue is histo. The suffix meaning inflammation is itis. Defined as any dysfunction of the brain. Encephalopathy. The medical term for inflammation of the liver is hepatitis. Incision into a muscle. Biotomy. Water-soluble vitamins B and C. Means 4 times per day. QID. Abbreviation for prescription. RX. Correct spelling of the term meaning inflammation of the tonsils. Tonsillitis. A patient's implied consent usually covers blood test. HIPAA requires covered entities to submit Medicare claims through electronic data exchange. The purpose of HIPAA security standards is to set national standards for safeguarding the confidentiality of electronic exchange of patient information. The purpose of the Good Samaritan Act is to protect healthcare providers rendering first aid from civil and criminal liability. Medical Practice Acts are laws enacted to define what is included in the practice of medicine. The technique used to let a patient know how you interpreted the message he or she is communicating is called restating. Positioning or sitting behind a desk communicates the message of authority. The term total permanent impairment means that the patient is unable to perform previous occupational duties, which is an insurance claim processing error. Using rule-out diagnoses. A non-duplication of benefits is also called coordination of benefits. Claims for Medicaid patients enrolled in a managed care plan are paid according to what fee schedule? Capitated. The policy describing a period of non-coverage for conditions diagnosed prior to the issuance of an insurance benefit plan is called a pre-existing conditions waiver. Medicare patients treated by a non-participating physician are responsible for a portion of the fee. Medicare Part B covers prescribed durable medical equipment, workers' compensation insurance provides benefits for occupational injuries. Accepting assignment on a Medicare claim means that the physician is compensated 80% of the approved amount. An example of a Medicare HCPCS code number is J540. A range of usual fees in the same community is the prevailing fee, the routine waiving of co-payments, is against federal guidelines. Claims with assigned assignment of benefits are paid to the physician. The notice sent to the patient showing the amount owed to the physician is called the itemized statement. The cost to a physician for the services of a collection agency is usually a percentage of each amount collected. Once a delinquent account has been turned over to a collection agency, the physician's office should refer all inquiries to the collection agency. The final statement for services rendered to a deceased patient should be addressed to the estate of the deceased. When a patient fails to keep an appointment, the medical assistant should document the failed appointment in the patient's chart. The method used to accommodate appointments for minor emergencies in the physician's office is to leave unassigned slots in the appointment schedule. What represents a successful trial balance? All transactions balance with the end-of-day journal. The petty cash fund may be used for small incidental items. When reconciling a bank account, the outstanding checks are those that have not cleared the bank. What is an acceptable patient check? Certified. What entry is recorded in the adjustment column? Insurance write-offs. Summaries identifying which patient accounts are 30, 60, 90, and 120 days overdue include age analysis. Banking fees will appear on a monthly statement in the form of a service charge. If the total income for 1 month is $17,500 and the total expenses for the same month are $15,500, the profit and loss statement would show a net profit of $2,000. To properly void a check, write void across the front end. Retain it with canceled checks in numeric order. The thoracic and abdominal cavities of the body are separated by the diaphragm. The main tissue of the outer layer of the skin in epithelial. The glands that are sac-like in structure and produce oily secretions that lubricate the skin are sebaceous. The portion of the skeletal bone that manufactures blood cells is the red bone marrow. The structures that attach muscles to bones are tendons. Nerve fibers are insulated and protected by a fatty material called myelin. The function of the lacrimal apparatus is to produce tears to lubricate the eyes. A bone that is part of the pelvic girdle is the ischium. The cellular components of blood include erythrocytes, leukocytes, and platelets. The chambers of the heart are the ventricles and atria. An organ located in the left upper quadrant is the spleen. An example of active immunity is producing antibodies as a result of having a disease. The structure in the body, also known as the voice box, is a larynx. The wave-like movement that propels food through the digestive tract is called Peristalsis. The process that does not require oxygen for the breakdown of glucose is referred to as being anaerobic. The term that means the body is in a state of equilibrium or balance is homeostasis. The funnel-shaped basin that forms the upper end of the ureter is the renal pelvis. In both males and females, the entire pelvic floor is called the perineum. A pregnancy that develops in a location outside the uterine cavity is referred to as ectopic. Which body system includes the thyroid and pituitary glands? Endocrine. The term inguinal pertains to what area or structure of the body? Groin. The measure of acidity or alkalinity of a solution is called telephone. A term that describes a solution that has the same concentration as cell fluids is isotonic. The fibrous bands that support organs to hold them in place are fascia. The membrane that surrounds the heart is the pericardium. The small tip of cartilage at the lower end of the sternum is the xiphoid process. A major muscle in the body that assists in raising the arm away from the body is the deltoid. Cells that carry or transmit impulses toward the central nervous system are called afferent neurons. The space in the brain where cerebrospinal fluid is formed are the brain. Cerebrospinal fluid is a clear, colorless body fluid found in the brain and spine. It is produced in the choroid plexuses of the ventricles of the brain. Impulses from the receptors for smell are carried to the brain by the olfactory nerve. The hormone that is essential for growth is produced in the pituitary gland. Epicardium and myocardium represent layers of the heart. The blood vessel that brings blood from the head, chest, and arms back to the heart is the superior vena cava. What is the proper sequence for blood flow in the body? Artery, arterial, capillary. The condition of inflammation of the lymphatic vessels is called lymphocytopenia. The lymphatic system does not include the following organ: hypothalamus. The hypothalamus is a section of the brain responsible for the production of many of the body's essential hormones. The process in which white blood cells take in and destroy waste and foreign material is called phagocytosis. The structure common to the respiratory and digestive systems is the pharynx. An accumulation of air in the pleural space that may lead to collapse of the lung is called pneumothorax. The leaf-shaped cartilage that covers the opening of the larynx is the epiglottis. Most of the digestive process occurs in the small intestine. The lining of the stomach has many folds called rugae. The first portion of the small intestine in the duodenum. An accumulation of excessive fluid in the intercellular spaces is called edema. The kidneys are located in the retroperitoneal space. The term hydronephrosis means distension of the renal pelvis resulting from obstructed flow of urine. The sex glands of the male and female reproductive system are the testes and ovaries. The bone that lies between the hip and the knee is the femur. The largest artery in the body is the abdominal aorta. The term that refers to absence of menstrual flow in a woman of reproductive age is amenorrhea. The hormone produced by the embryonic cells of the fetus is human chorionic gonadotropin hormone. A substance necessary for proper formation of a blood clot is thrombin. The left atrioventricular valve in the heart is also known as the mitral valve. The only artery in the body that carries deoxygenated blood is the pulmonary artery. A localized dilation resulting from weakness of a blood vessel wall is an aneurysm. An example of a chronic obstructive pulmonary disease is emphysema. A portion of the large intestine is the sigmoid. A chronic degenerative disease of the liver is cirrhosis. The tube that permits urine to pass from the bladder to the outside of the body is the urethra. The innermost layer of the uterus is the endometrium. The frontal or coronal plane of the body divides the body into front and rear. The membrane attached to internal organs is the visceral layer. The term that describes a disorder that breaks down tissues in a body system is degenerative. The study of the cause of any disease or of all factors that may be involved in the development of a disease is etiology. The chronic skin condition characterized by a red, flat area covered with silvery scales is psoriasis. Which of the following is not one of the cranial bones? Frontal, parietal, ethmoid, temporal, maxilla. Maxilla. The bone that is part of the shoulder girdle and is between the sternum and the scapula is the clavicle. The type of muscle responsible for producing peristalsis is smooth. The type of joint motion that allows movement away from the midline of the body, such as moving the arms straight out to the sides, is abduction. The sympathetic system of the autonomic nervous system is responsible for dilation of bronchi of the lungs. The portion of the brain that aids in the coordination of voluntary muscle action is the cerebellum. Strabismus is a condition of the eye causing cross-eyed appearance. A structure found in the inner ear is the cochlea. The clusters of cells called the islets of Langerhans are located in the pancreas. A goiter is associated with abnormal function of the thyroid gland. The Rh factor in blood is an antigen that affects a person's blood type. The area of the heart that initiates a heartbeat is the sinoatrial node. A heart disease that is present at birth is congenital heart disease. Which blood vessel is proximal to the heart? Ascending aorta. Acquired natural active immunity is achieved by contracting the disease. The human immunodeficiency virus is the cause of which disease? Acquired immunodeficiency syndrome. The sac covering the lungs is the pleural sac. A communicable, infectious disease of the lungs is tuberculosis. An example of inflammatory bowel disease is Crohn's disease. Function of the liver is to production of bile, store and release glucose as needed, break down fats in the small intestine during digestion, production of certain proteins for blood plasma, detoxify harmful substances such as alcohol and certain drugs. The fluid contained within the body cells is called intracellular fluid. Two important electrolytes found in the body are sodium and potassium. A condition resulting from renal failure and causing high levels of blood urine nitrogen is uremia. The period of pregnancy is called gestation. The hormone that causes contraction of uterine muscle during labor is oxytocin. The region located directly below the umbilical region is the hypogastric region. An example of exocrine glands are sebaceous glands. The order of the vertebral column from top to bottom is cervical, thoracic, lumbar, sacral, coccyx. The muscle located on the anterior thigh and that functions to extend the leg is the quadriceps femoris. The artery located in the upper arm is the brachial artery. Any foreign substance that enters the body and induces an immune response is an antigen. The smaller leg bone lateral to the tibia is the fibula. The small pouch that is the first part of the large intestine is the cecum. The hormone that regulates the amount of water that is eliminated with urine is ADH, antidiuretic hormone. An excessive curvature in the thoracic portion of the spinal column, also known as hunchback, is kyphosis. Diabetic retinopathy is a result of damage to the eyes. True or false? Type 2 diabetes is non-insulin-dependent diabetes. True. What protein is found in the epidermis that makes the skin waterproof? Keratin. What is the most common condition of the eye associated with aging? Presbyopia. What structure is at the neck of the male bladder and surrounds the urethra? Prostate. The epigastric anatomical region of the abdomen is located distal to the sternum. Collagen, a substance found in the dermis, is an fibrous tissue. What gland is located on the sides of the vaginal opening and produce mucus? Bartholin. The master gland of the body is the pituitary. A fracture of the radius characterized by bending of the bone with the skin left intact is referred to as greenstick closed. Spermatozoa normally fertilize the female ovum in the fallopian tube. The glomerulus is a cluster of blood capillaries found in the nephron. The disorder characterized by uncontrollable episodes of falling asleep is narcolepsy. The regulation of body temperature is controlled by the hypothalamus. Which of the following substances is not a neurotransmitter? Acetylcholine, norepinephrine, epinephrine, or aldosterone? Aldosterone. Aldosterone is a steroid hormone produced by the outer section of the adrenal cortex in the adrenal gland. Cranial nerve eye. The olfactory nerve is related to the sense of smell. A blood cell that carries oxygen and has no nucleus is an erythrocyte. During respiration, exhaled air contains primarily carbon dioxide. A condition causing a backflow of stomach acid through an incompetent esophageal sphincter is called GERD. Informed consent requires that the information provided is enough for the patient to make an educated decision. Law refers to the recognized rule of conduct enforced by legal authority. The law requires a physician to report to the appropriate authorities a person suspected of elderly abuse. Consent for a person's own medical treatment may be given by a 17-year-old who is in the Navy. A patient's implied consent usually covers an electrocardiogram. A tort is a type of civil law. Malfeasance is one form of malpractice. A physician may not obtain his or her license by registration. Advance directives include a medical power of attorney. Respondet superior refers to a physician's responsibility for the actions of his or her staff. The Good Samaritan Act does not cover a healthcare provider who volunteers to provide first aid at a charitable fund run. A physician who accepts payment from another physician for the referral of a patient is guilty of fee splitting. Failure to act in a manner that a prudent and reasonable person would under similar circumstances is negligence. The 4 Ds are used to determine malpractice. What are the Ds? Duty, derelict, direct cause, damage. A minor may not consent for sterilization. A communicable disease to be reported to the county health department is rubella. Medical examiner cases involve death. A situation in which the very nature of the injury implicates malpractice is called res ipsa loquitur. The thing speaks for itself. The strongest mandatory credential regulated by a state to practice a profession is a licensure. Medical assistants may be certified. Ethics deal with morals. The patient's Bill of Rights includes the right to confidentiality. The first medical code of ethics was written by Cma Rma. A medical assistant publicly criticizes a physician's diagnostic skills. This is an example of slander. Which of the following condition must be reported? Hypertension, hepatitis B, hemiplegia, hemorrhage, or anemia? Hepatitis B. A court order instructing the physician to report to court at a certain time and date is a subpoena. A living will is an advance directive stating the patient's decisions for medical care before an incapacitating event. Dr. Smith is no longer willing to take care of Mr. Watson. If Dr. Smith does not give Mr. Watson proper notification and appropriate time to find a new physician, Dr. Smith is guilty of abandonment. The patient puts out his or her arm to allow the physician to cleanse an abrasion. This type of consent is implied. The physician performs an elective surgical procedure without written consent. The physician is guilty of battery. The purpose of the Good Samaritan Act is to protect healthcare workers from liability when rendering emergency care. A patient is treated for a minor gunshot wound that he states was sustained during a hunting accident. The physician is obligated to report this as part of public duty. A patient calls to make an appointment and states the symptoms for the office visit. The scheduler says, "That sounds like the flu." The healthcare worker violated the scope of practice. Mandatory reporting is required in all of the following cases except child abuse, unknown cause of death, alcohol abuse, or elder abuse. Alcohol abuse. A form of malpractice is nonfeasance, which means failure to act when duty is indicated, resulting in or causing harm. A physician casts a fracture of the ulna incorrectly. This results in malformation of the arm. The physician could be charged with tort. The medical office must comply with the regulations and standards of OSHA. The Joint Commission does not set standards and regulations that must be followed by medical offices. The physician's office shares a patient's medical information with an insurance company. The physician's office did not have the patient's written consent. The office is guilty of breach of confidentiality. A wheelchair patient could not use the medical office restroom because it was too small for the wheelchair. The office is in violation of ADA. A typical patient's Bill of Rights includes the right to refuse treatment. A valid contract must be entered into by competent parties. The purpose of law is to remedy wrongs. An express contract is written. Written consent for medical care must be voluntary. Examples of ethical cases affected by the law are cases involving the right to die. Ethical issues are addressed in professional codes. In cases of public safety, the laws protecting the general population usually take precedence over an individual's rights. A medical assistant could be held liable for the actions of a coworker. A patient outcome resulting from the quality improvement process may be preventing illness. Giving a patient an injection ordered by the physician is not risk management. The AMA principles of medical ethics require a physician to report other physicians deficient in character or competence. What prohibits job discrimination for race, color, religion, sex, or national origin? EOC. Employment law is generally considered administrative law. The purpose of the red flags rule is to guard for medical identity theft. Informed consent requires that the information provided is enough for the patient to make an educated decision. Law refers to the recognized rule of conduct enforced by legal authority. The law requires a physician to report to the appropriate authorities a person suspected of elderly abuse. Consent for a person's own medical treatment may be given by a 17-year-old who is in the Navy. A patient's implied consent usually covers an electrocardiogram. A tort is a type of civil law. Malfeasance is one form of malpractice. A physician may not obtain his or her license by registration. Advance directives include a medical power of attorney. Respondet superior refers to a physician's responsibility for the actions of his or her staff. The Good Samaritan Act does not cover a healthcare provider who volunteers to provide first aid at a charitable fund run. A physician who accepts payment from another physician for the referral of a patient is guilty of fee splitting. Failure to act in a manner that a prudent and reasonable person would under similar circumstances is negligence. The 4 Ds are used to determine malpractice. What are the Ds? Duty, derelict, direct cause, damage. A minor may not consent for sterilization. A communicable disease to be reported to the county health department is rubella. Medical examiner cases involve death. A situation in which the very nature of the injury implicates malpractice is called res ipsa loquitur. The thing speaks for itself. The strongest mandatory credential regulated by a state to practice a profession is a licensure. Medical assistants may be certified. Ethics deal with morals. The patient's Bill of Rights includes the right to confidentiality. The first medical code of ethics was written by Hammurabi. A medical assistant publicly criticizes a physician's diagnostic skills. This is an example of slander. The following condition must be reported. Hepatitis B. A court order instructing the physician to report to court at a certain time and date is a subpoena. A living will is an advance directive stating the patient's decisions for medical care before an incapacitating event. Dr. Smith is no longer willing to take care of Mr. Watson. If Dr. Smith does not give Mr. Watson proper notification and appropriate time to find a new physician, Dr. Smith is guilty of abandonment. The patient puts out his or her arm to allow the physician to cleanse an abrasion. This type of consent is implied. The physician performs an elective surgical procedure without written consent. The physician is guilty of battery. The purpose of the Good Samaritan Act is to protect healthcare workers from liability when rendering emergency care. A patient is treated for a minor gunshot wound that he states was sustained during a hunting accident. The physician is obligated to report this as part of public duty. A patient calls to make an appointment and states the symptoms for the office visit. The scheduler says, "That sounds like the flu." The healthcare worker violated the scope of practice. Mandatory reporting is required in all of the following cases except child abuse, unknown cause of death, alcohol abuse, or elder abuse. Alcohol abuse. A form of malpractice is nonfeasance, which means failure to act when duty is indicated, resulting in or causing harm. A physician casts a fracture of the ulna incorrectly. This results in malformation of the arm. The physician could be charged with tort, a wrong that is committed by someone who is legally obligated to provide a certain amount of carefulness in behavior to another and that causes injury. The medical office must comply with the regulations and standards of OSHA. The Joint Commission does not set standards and regulations that must be followed by medical offices. The physician's office shares a patient's medical information with an insurance company. The physician's office did not have the patient's written consent. The office is guilty of breach of confidentiality. A wheelchair patient could not use the medical office restroom because it was too small for the wheelchair. The office is in violation of ADA. A typical patient's Bill of Rights includes the right to refuse treatment. A valid contract must be entered into by competent parties. The purpose of law is to remedy wrongs. An express contract is written. Written consent for medical care must be voluntary. Examples of ethical cases affected by the law are cases involving the right to die. Ethical issues are addressed in professional codes. In cases of public safety, the laws protecting the general population usually take precedence over an individual's rights. A medical assistant could be held liable for the actions of a coworker. A patient outcome resulting from the quality improvement process may be preventing illness. Giving a patient an injection ordered by the physician is not risk management. The AMA principles of medical ethics require a physician to report other physicians deficient in character or competence. What prohibits job discrimination for race, color, religion, sex, or national origin? EOC. Employment law is generally considered administrative law. The purpose of the red flags rule is to guard for medical identity theft. Defense mechanisms are defined as behavior that is used to protect the ego from guilt, anxiety, or loss of esteem. Regression is an attempt to withdraw from an unpleasant circumstance by retreating to an earlier, more secure stage of life. Denial is refusal to accept painful information that is readily apparent to others. Repression. Similar to denial, but it is a totally subconscious reaction. In the case of repression, the person seems to experience temporary amnesia. It is the mind's way of defending itself from mental trauma by forgetting or wiping things out of the conscious memory. Projection. Attributing unacceptable desires, impulses, and thoughts falsely to others to avoid acknowledging they are actually the person's own experiences. It is a means of defending against feelings or urges the person does not want to admit they are experiencing. Sublimation is the channeling of a socially unacceptable behavior into a socially acceptable behavior. An overly aggressive person directed to play football to relieve aggression is an example. Constructive behavior is substituted for destructive behavior. Displacement is the subconscious transfer of unacceptable emotions, thoughts, or feelings from oneself to a more acceptable external substitute. A patient who is angry with a provider for some reason slams the door as he or she leaves the clinic. Compensation. Rationalization is the mind's way of making unacceptable behavior or events acceptable by devising a rational reason. The purpose of rationalization is to avoid embarrassment or guilt or to avoid obeying a directive. Undoing. Undoing is actions designed to make amends or to cancel out inappropriate behavior. Showering the abused person with gifts to compensate for unacceptable actions that took place in the past is an example. High context communication relies on body language, reference to environmental objects, and culturally relevant phraseology to communicate an idea. Low context communication uses few environmental idioms to convey an idea. It relies on explicit and highly detailed language. Screening. A simple process of asking the caller's name and the reason for the call. SOAP means as subjective impressions O objective clinical evidence A assessment or diagnosis P plans for further studies, treatment, or management E education for patient R response of patient to education and care given. POMR means problem-oriented medical record. HIPAA is the Federal Health Insurance Portability and Accountability Act of 1996. The primary goal of the law is to make it easier for people to keep health insurance, protect the confidentiality and security of healthcare information, and help the healthcare industry control administrative costs. Source-oriented medical record groups information according to its source. Facilities use this method because it makes different types of information quickly accessible. HCPCS stands for the Healthcare Common Procedure Coding System. HCPCS code sets are intended to be a uniform, fairly universal form of classifying similar durable medical equipment, prosthetics, and orthotics. The Joint Commission is a United States-based non-profit tax-exempt 501 organization that accredits more than 20,000 healthcare organizations and programs in the United States. A goiter can occur in a gland that is producing too much hormone, too little hormone, or the correct amount of hormone. A goiter indicates there is a condition present which is causing the thyroid to grow abnormally. Chest precordial leads, V leads or C leads. Bipolar leads. V1. Fourth intercostal space at the right margin of sternum. V2. Fourth intercostal space at the left margin of sternum. V3. Active listening. Received message is paraphrased back to the sender to verify the correct message was decoded. Bias. Slant toward a particular belief. Body language. Non-verbal communication that includes unconscious body movements, gestures, and facial expressions that accompany verbal messages. Closed questions. Questions answered with a yes or no. Clustering. a grouping together of nonverbal messages into statements or conclusions. Compensation. Blank is a conscious or subconscious overemphasizing of a characteristic to offset a real or imagined deficiency. Involves substituting strength for a weakness and may be viewed as healthy. Congruency. The verbal message and the non-verbal message must agree. Cultural brokering. The act of bridging, linking, or mediating between groups or persons through the process of reducing conflict or producing change. Culture is a pattern of many concepts, beliefs, values, habits, skills, instruments, and art of a given group of people in a given period. Decode. To translate into language that is easily understood, to interpret. Defense mechanism. Behavior that is used to protect the ego from guilt, anxiety, shame, or loss of esteem. Denial. Refusal to accept painful information that is readily apparent to others. Displacement. Displacing negative feelings onto something or someone else with no significance to the situation. Encoding. Creating a message to be sent. Hierarchy of needs. Needs that are arranged in a specific order or rank, sequential arrangement associated with Abraham Maslow. High context communication. Relies on body language, reference to environmental objects, and culturally relevant phraseology to communicate an idea is indirect and seems to take forever to reach a conclusion, often thought of as mentally slow or uneducated. Indirect statements. Means of eliciting a response from a patient by turning a question into a statement of interest. Interview techniques. Methods of encouraging the best communication between themselves and the patient. Kinesics. Study of body language. Low context communication. Uses few environmental idioms to convey an idea. It relies on explicit and highly detailed language. It is direct and in your face, often thought of as being rude or arrogant. Masking. Attempt to conceal or repress true feelings or the message. Open-ended questions. Questions that encourage verbalization and response. Questions that seek a response beyond a simple yes or no. Perception. Conscious awareness of one's own feelings and the feelings of others. Prejudice. Opinion or judgment that is formed before all the facts are known is a preconceived and unfavorable concept. Projection. Blank is attributing unacceptable desires, impulses, and thoughts falsely to others to avoid acknowledging they are actually the person's own experiences. Rationalization is the mind's way of making unacceptable behavior or events acceptable by devising a rational reason. The purpose is to avoid embarrassment or guilt or to avoid obeying a directive. Regression. An attempt to withdraw from an unpleasant circumstance by retreating to an earlier, more secure stage of life. Repression. Coping with an overwhelming situation by temporarily forgetting it. Temporary amnesia. Roadblocks. Verbal or nonverbal messages that block communication. Sublimation. Redirecting a socially unacceptable impulse into one that is socially acceptable. Therapeutic communication. It introduces an element of empathy into what can be a traumatic experience for the patient and uses specific and well-defined professional skills. Time focus. Defines a period of time that is important and to which an individual's actions are directed or oriented. Undoing. Actions designed to make amends or to cancel out inappropriate behavior. Burnout. a state of fatigue or frustration brought about by devotion to a cause, a way of life, or a relationship that failed to produce the expected reward. Goal. Result or achievement toward which effort is directed. Inner-directed people. People who decide for themselves what they want to do with their lives. Long-range goals. Achievements that may take 3 to 5 years to accomplish, give direction and definition to our lives and serve to keep us on track, so to speak. Outer-directed people. People who let events, other people, or environmental factor dictate their behavior. Parasympathetic nervous system. Part of the autonomic nervous system that returns the body to its normal state after stress has subsided. Self-actualization. Being all that you can be, developing your full potential and experiencing fulfillment. Short-range goals. Take apart long-range goals and reassemble the required activities into smaller, more manageable time segments. Time segments may be daily, weekly, monthly, quarterly, or yearly periods. Stress. The body's response to mental and physical change. Stressors. Demands to change that cause stress. Sympathetic nervous system. Large part of the autonomic nervous system that prepares the body for fight or flight. Communication. Blank must be in a non-technical language the patient can understand. Communication cycle. Involves sending and receiving messages even when not consciously aware of them. 4 steps of communication cycle. The sender, the message, and a channel or mode of communication, the receiver, and feedback. Sender. Encodes message. Message. The content being communicated, speaking, listening, gesturing, writing. Receiver. Is the recipient of the sender's message and decodes the message. 4 modes of communication. Speaking, listening, gestures or body language, and writing. Listening is the primary sensory skill used in verbal communication. Phi. Protected health information. CMAS. Certified Medical Administrative Specialist. Feedback takes place after the receiver has decoded the message sent by the sender. It is the receiver's way of ensuring that the message was sent and also provides an opportunity for the receiver to clarify any misunderstanding regarding the original message and ask for additional information. Listener. A good blank is alert to all aspects of the communication cycle, the verbal and nonverbal message, as well as verification of the message through appropriate feedback. Active listening involves listening with a third ear, that is, being aware of what the patient is not saying or picking up on hints to the real message by observing body language. 3 listening goals. To improve listening skills sufficiently so that patients are heard accurately, to listen either for what is not being said or for information transmitted only by ends, to determine how accurately the message has been received. Communication. Blank is and always will be the basis for any therapeutic relationship. Verbal communication takes place when the message is spoken. 5 Cs of communication. Complete, clear, concise, cohesive, courteous. Complete. The message must be blank with all the necessary information given. Clear. Healthcare professionals must be able to articulate by using good diction and by enunciating each word distinctly. Concise. A blank message is one that does not include any unnecessary information. It should be brief and to the point. Cohesive. A blank message is organized and logical in its progression. The message does not ramble and does not jump from one subject to another. Communication. Good blank skills are necessary in establishing rapport with patients. Respected. Patients feel blank and validated when called by their full name. Verbalize. Patients should be encouraged to blank their feelings and concerns. Technical. Patients should be given blank information in a manner that they can understand. Practical. Patients should be allowed to make blank application to their personal health needs. Courteous. It only takes a moment to acknowledge a patient with a smile or by name. Nonverbal. Blank communication is the language we learn first, and feelings and emotions are communicated most often this way. 70. Experts tell us that blank % of communication is nonverbal. 23. The tone of voice communicates blank % of the message. 7. Only blank % of the message is actually communicated by the spoken word. Facial expression. Blank is considered one of the most important and observed nonverbal communicators. Eyes. Often expressions of joy and happiness or sorrow and grief are reflected through the blank. Staring. Blank is dehumanizing and is often interpreted as an invasion of privacy. Eye contact. A lack of blank may also be viewed as avoidance or disinterest in being involved. Eyebrow. The movements of the blank indicate many nonverbal cues as well. Surprise, puzzlement, worry, amusement, and questioning are often nonverbal messages reflected by the position of them. Forehead. Wrinkling of the blank sends similar messages that the eyebrows do. Personal space is the distance at which we feel comfortable with others while communicating. Comfortable personal space. Intimate, touching to 1 1/2 feet. Personal, 1 1/2 to 4 feet. Social, 4 to 12 feet. And public, 12 to 15 feet. Posture relates to the position of the body or parts of the body. It is the manner in which we carry ourselves or pose in situations. Tighten. We tend to blank up in threatening or unknown situations. Relax. We tend to blank in non-threatening environments. Kinesics. Those who study blank believe that a posture involves at least half the body and that the position can last for nearly 5 minutes. Closure. When the patient is seated with the arms and legs crossed, the message of blank or being opinionated may be relayed. Open. When the patient is sitting in a chair relaxed with the hands clasped behind the head indicates an attitude of being blank to suggestions. Slumped. Blank shoulders may signal depression, discouragement, or, in some cases, even pain. Position. Blank, the physical stance of two individuals while communicating, is a key factor to consider while communicating with the patient. Face-to-face. Most provider-patient relationships use the blank communication arrangement. Superiority. Standing over a patient can convey a message of blank. Distance. Too much blank between the two parties may be interpreted as avoidance or exclusivity. Leaning. Generally, blank toward the patient expresses warmth, caring, interest, acceptance, and trust. Away. Moving blank from the patient may be interpreted as dislike, disinterest, boredom, indifference, suspicion, or impatience. Talk. Most of us use gestures and mannerisms when we blank with our hands. Finger tapping. This common gesture possibly means impatience, nervousness. Shrugged shoulders. This common gesture possibly means indifference, discouragement. Rubbing the nose. This common gesture possibly means puzzlement. Anger. The gesture of widened knuckles and clenched fists is usually a sign of blank. Fidgeting. This common gesture possibly means nervousness. Touch. Blank is a powerful tool that communicates what cannot be expressed in words. Perception. Learning to use blank involves the ability to sense another's attitudes, moods, and feelings. Negative. Anything that interferes with the patient's ability to focus has a blank impact on therapeutic communication. Age and gender are factors with a strong influence on communication. Economics. The influence of blank may reveal a discomfort if the office staff and patients have a different perception about how billing is managed and when and how payment is expected. Educational and life. Blank experiences will, in part, determine how patients react to their care. Hostile. When individuals are not aware of their biases or prejudices, blank attitudes may prevail. Defense. A patient who is frightened, ashamed, guilty, or threatened often will resort to blank mechanisms as a means of avoiding injury to the ego. Defense mechanisms. A mentally healthy person uses blank to put a problem on hold until sufficient time has passed to permit him or her to address it without unacceptable emotional pain. Regression. A toddler's regression to bedwetting or soiling himself or herself shortly after a new baby arrives in the family is an example of what kind of defense mechanism? 4 stages of emotions. Denial is often the first stage of an emotional response after a traumatic event. The second stage is anger toward the event, the medical staff, God, or others. The third stage is frequently depression, and eventually a person reaches the final stage of acceptance. Rational reason. The blank is usually a stretch of the truth and can be quite apparent to disinterested individuals. Caregiving. Blank expectations refer to the arrangements for taking responsibility for medical requirements. Future. Blank time focus is found in persons whose physical needs have been met and who can sacrifice immediate gratification to achieve perceived greater returns. They are time conscious and plan out their daily lives in considerable detail. Present. Blank time focus is found in persons who are less assured of being able to meet their physical needs. It is difficult to plan for the future when basic items in the hierarchy of needs have not been met. Punctuality usually is not important to these people. Past. Blank time focus is associated with persons from cultures having long-standing traditions. Tradition becomes the central focus of their life. Abraham Maslow is considered the founder of humanistic psychology and is most well known for his hierarchy of needs. Maslow's theory. According to human needs could be grouped into 5 levels. He also theorized that each level of need must be satisfied before one could move on to the next level. Maslow's first level. The needs in include physiologic or survival needs. These needs include food, water, and air to breathe, homeostasis for the body. Maslow's second level. The needs in includes needs of safety and security, that is, the need for security, stability, and protection. Safety needs also include the need for structure, law and order, and limits. Maslow's third level. Maslow's fourth level. Prestige and esteem needs. There is the desire for achievement, strength, and confidence. Also, there is the need for recognition, prestige, reputation, status, and even fame. Satisfaction of these needs leads to feelings of self-confidence and worth. Maslow's fifth level. This level is self-actualization. In this stage, we are at our peak, doing what truly fits us. It is an achievement of potential. Multicultural communication. is the ability to communicate effectively with individuals of other cultures while recognizing one's own personal cultural biases and prejudices and putting them aside. 1/3. Approximately blank blank of the population of the U.S. comes from a culture other than mainstream American. Cultural broker serves as a go-between or one who advocates on behalf of another individual or group within the healthcare community. Cultural brokers respect the values of diverse cultures and healthcare systems and are knowledgeable of both. They are able to overcome any existing language barriers so that everyone understands each other clearly. Goal: the blank of cultural brokering is to increase the capacity of healthcare and mental health programs to design, implement, and evaluate culturally and linguistically competent service delivery systems. Medical interpreter. 3rd. When the MA is interviewing the patient for the chief complaint, it is important to listen with a blank ear. Listen to what the patient is not saying but is apt to exhibit through nonverbal communication. Point of care refers to the location in which the patient and provider or patient and office personnel physically interact. This interaction may take place at the reception desk, in the laboratory, or in the examination room. Eustress. Positive feelings, good. Distress. Negative feelings, bad. 3 categories of stress: frustrations, conflicts, pressure. Frustrations. Circumstances that prevent us from doing what we want to do. Conflicts. Incompatibility between two important things or objectives equally important to us. Pressure. Demands of schedule, workload, or expectations placed on us by ourselves or others. Hans Selye first conceived the theory of non-specific reaction as stress. The body does not differentiate positively and negatively induced stress. It is only the level of the stress and its duration that affect the body. Short duration. Blank blank stress, sometimes called acute stress, can be beneficial. Long duration. Blank blank stress is sometimes called episodic or chronic stress. Episodic. Blank stress is the result of events over which we have control. Chronic. Blank stress is the result of events over which we have little control. Stress cannot be prevented. In fact, life would be dull without the short duration kind. GAS. General Adaptation Syndrome. 4 stages of stress. Alarm, fight or flight, exhaustion, return to normal. Alarm. The body begins to perceive and be aware of stress. First stage. Fight or flight. The sympathetic nervous system prepares the body for blank blank blank. Second stage. Exhausted. The body becomes blank by its reaction to stress. Third stage. Return to normal. The parasympathetic nervous system is activated and the body will then blank blank blank. Fourth stage. Planning. Blank and prioritization can help to prevent and reduce stress when faced with the inevitable situation of too much work and too little time. Worry is defined as undue concern for problems over which you have no control. Focusing on the positive. Identifying what is being accomplished versus focusing on what is not being accomplished or what does not meet your expectation. 4 stages of burnout. Honeymoon, reality, dissatisfaction, sad state. Goal. A blank must be specific, challenging, realistic, attainable, and measurable. Specific goals are focused and have precise boundaries. Challenging goals creates enthusiasm and interest in achievement. Realistic goals are practical or beneficial for the present and for future self-actualization. Attainable goal refers to the fact that the goal is possible to fulfill. Measurable goal: achieve some form of progress or success. Answering services: services employed to answer the calls of an ambulatory care setting after hours. Unlike an answering machine, a live operator answers the call and forwards it appropriately. Articulating: expressing oneself clearly and distinctly. Automated routing unit: telephone system that answers a call and uses a recorded voice to identify departments or services. Buffer words: expendable words used while answering the telephone may consist of introductory words, phrases, or statements such as good morning. Cellular telephones: a short-range portable device used for voice or data communication over a network of base stations known as cell sites. The cell sites are interconnected to the public switch telephone network. Clinical email: type of email established using defined protocols as a means of communication between providers and established patients. Electronic mail: the process of sending, receiving, storing, and forwarding messages in digital form over computer networks is a non-real-time method of communication. It permits us to leave a message at our convenience and allows the other person to read and respond at their convenience. Encrypted email: the process of coding email to render the transmission essentially secure. Enunciation: speaking clearly, articulating. Etiquette: manners, politeness, proper behavior. Fax: machine that sends documents from one location to another by way of telephone lines. Fluent: able to write or speak easily or flowing smoothly. Good Samaritan laws: laws designed to protect individuals from legal action when rendering emergency medical aid without compensation within the areas of their training and expertise. Jargon: words, phrases, or terminology specific to a profession. Modulated: speech that varies in pitch and intensity. Obfuscation: making things clouded or confused. Pagers: also known as beepers, one-way paging systems often used inside hospitals and by providers on call. Pagers only receive signals. Pronunciation: saying words correctly. Screening: evaluating patient symptoms to determine emergent needs, sometimes used to determine the next best course of action when assisting a provider in giving appropriate patient care. Uniform Resource Locator: the address that defines the route to file on the web or any other internet facility. Voice over Internet Protocol: the real-time transmission of voice signals over the Internet or Internet Protocol network. Accession Record: logbook used to assign numbers to correspondents or patients. Caption: are used to identify major sections of file folders by more manageable subunits. Cross-reference: notation in a file to direct the reader to a specific record that may be filed under more than one name subject where the surname is not easily recognizable. Indexing: selecting the name, subject, or number under which to file a record and determining the order in which the units should be considered. Key unit: first indexing unit of the filing segment. Outguide: card, folder, or slip of paper inserted temporarily in the files to replace a record that has been retrieved from the files. Problem-oriented medical record. A type of patient chart record keeping that uses a sheet at a prominent location in the chart to list vital identification data. Patient medical problems are identified by a number that corresponds to the charting. For example, bronchitis is number 1, a broken wrist is number 2, and so forth. Purging. Method of maintaining order in the files by separating active from inactive and closed files. SOAP. Acronym for Patient Progress Notes based on subjective impressions, objective clinical evidence, assessment or diagnosis, and plans for further studies. Source-oriented medical record. A type of patient chart record keeping that includes separate sections for different sources of patient information, such as laboratory reports, pathology reports, and progress notes. Tickler file. System to remind of action to be taken on a certain date. Unit. Each part of a name words or numbers that will be indexed and coded for filing. SOPR. Acronym for Patient Progress Notes based on subjective impressions, objective clinical evidence, assessment or diagnosis, plans for further studies, education for patient and responsive patient to education and care given. EHR. Electronic Health Records. TPMS. Total Practice Management System. Total Practice Management System. Permits patient information, notes, patient requests, and schedules to be inserted into the electronic chart with just a click of the mouse or a few keystrokes. Contact. Today, the first blank is usually with an automated phone system. Friendly. The program set up in the automatic phone system should be user blank. 1. If at all possible, the menu system should only be blank level deep, meaning the selection should not lead to another menu. First 3. To create a positive impression, answer the telephone by the end of the blank ring and certainly within blank rings. Interrupt. If your station has more than one incoming line, it may be necessary to blank a conversation to answer another CLL. Hold. You may place a call on blank only once, not repeatedly during the conversation. Wait. You must blank for the caller on the phone to give permission to be put on hold before you can answer the other line. First impressions are solely conveyed through verbal and non-verbal communication. Telephone. In blank communications, personality and attitudes are conveyed only through the tone in which words are spoken and the words themselves. Interruption. Remember, callers are not in blank of your work but the reason for your job. Responsibility. No matter what other duties are pressing, the primary blank of every employee in a medical office is patient care. Everything else is secondary. Modulated. Altered in volume as well as tone or pitch. 1 to 2 inches. Hold the handpiece correctly about blank away from the mouth and project your voice out the mouthpiece, not over it. Headsets. The use of blank permits the mouthpiece to be positioned appropriately and frees the hands to locate and record information easily. Posture. Blank, the way the body is carried, also affects the voice. Diaphragm. If slumped in a chair, the blank is compressed and breathing may be restricted. Enthusiasm. Blank conveys interest to the caller and projects a sincere, caring attitude that can be heard over telephone. Medical assistant. The blank blank must always be patient and in control. Call. No blank should be left unacted for more than 20 to 30 seconds. Personal. Blank calls should not be permitted in the medical office because the busy lines are intended for business. Items for answering calls. Facility. When answering incoming calls, the name of the blank should be clearly identified as well as the name of the person with whom the caller is speaking. Medical record retrieval. Obtain the caller's full name and correct spelling and ask if this is an emergency call. Ask for the caller's telephone number, street address, and date of birth. DOB. Date of birth. 2 reasons for screening calls. To be sure the caller talks to the person who will be most helpful, to ensure the provider's time with calls is efficiently managed. Screening process is usually a simple process of asking the caller's name and the reason for the call. Argue. Do not blank with the caller. Transferred. The call will need to be blanked to someone with more expertise in a particular area. Taking a message. When blank blank, it is advisable to use a standard telephone message pad with a carbonless copy that allows the office to maintain a record of all incoming calls or appropriate TPMS screen. 8 items for message taking. Patient's chart. Always attach a message from a patient to the blank blank before placing the message on the provider's desk. Established patient. When in blank blank calls to set up an appointment, record the patient's name, date, time, telephone number, and the reason for the appointment. New patients. Blank blank require the same information as the established patient plus some additional information, including address, HDOB, employer, insurance carrier, insurance ID numbers, name of insured, name of referral source. Scheduling appointments. A major portion of telephone communications is spent blank blank. Scheduling patient tests. Blank 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 can involve a great deal of coordination. Often appointment times need to be arranged among providers, the patient, and the facility. A test may be conducted. Billing questions. Blank blank can be involved and complex, and medical assistants should be prepared to answer questions by retrieving information on the patient's insurance and billing status. Providers. Blank have many demands on their time: surgeries, hospital rounds, patient appointments, documentation, and consultations with other providers, to name a few. Provider-referred calls. Examples of blank 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 are other providers, stat reports, provider's family. Cma. Donald A. Balessa, JD, MBS, Executive Director and Legal Counsel for the blank states. Procedures which constitute the practice of medicine or which state law specifically delegates to licensed professionals to perform may not be delegated to unlicensed professionals such as medical assistants. Call 911. Prior to screening calls, the medical assistant should always direct the call to blank blank if the caller believes they may be experiencing a life-threatening emergency. Telephone screening. Blank blank is one of the most important functions for the person answering the telephone. Paid. Good Samaritan laws do not cover blank employees, only uncompensated situations. Diffuse. When dealing with angry callers, the first priority is to blank the situation. Medical. Requests for blank information over the telephone should be discouraged. Medical chart. When a patient telephones the office to request prescription refills, is displeased with medical treatment, or expresses some form of a complaint, documentation of the call should always be recorded in the blank blank. Directory. The telephone blank contains an organized, accurate, and complete listing of the name, address, zip code, and area code with telephone number for most individuals with telephone service. White pages. Pages within the directory for residences. Yellow pages. Pages within the directory for advertisements. Blue pages. Pages within the directory for business numbers. Hospital directory. Online telephone directories. http://www.yellowpages.com, http://www.dexonline.com, http://www.switchboard.com, http://www.waterpages.com, http://www.anywho.com. Mandatory. It is blank that the calls be made from a telephone where you cannot be overheard by other patients or people in the reception area. End. Most offices call the next day's patients to confirm appointments near the blank of each day. Collection and insurance. Blank blank calls, as well as pharmacy callbacks, are usually done either before the office is open for patients in the morning during the period from noon to 2 p.m. when the office is closed for lunch, or after the last patient has been seen. Direct dialing. Most long-distance calls medical assistants make are likely to be blank blank calls. Direct dialing calls. Calls placed without the help of an operator. Operator-assisted calls are more costly calls and should be handled through other alternatives if possible. Examples of operator-assisted calls: person-to-person calls, conference calls, international calls, collect calls. Conference calls may be local or long distance and are convenient for communicating or discussing information with several individuals at the same time. International direct distance dialing is available in many parts of the U.S. Additional numbers or codes may preface the international access, country, and city codes when using IDDD. Station-to-station calls may be dialed following the sequence: dial the international code 011, dial the country code, dial the city code, dial the local telephone number, press the pound sign button if the telephone is touch-tone. 45. It may take up to blank seconds after dialing any international code for the ringing to begin. Time zones. Pacific, Mountain, Central, and Eastern times and usually span a 3-hour difference. Two most important issues in the medical setting are: 1. Patient confidentiality, 2. Right to privacy. Legal and ethical. Respecting the confidentiality of all patient information is a blank obligation. Lawsuits. Violations of confidentiality leave you and your provider open to blank. No. Blank information about patients is to be discussed outside of the office with family or friends or with other patients. Never. Necessary. Minor's right to privacy. You may discuss medical information with the patient's parent or legal guardian except concerning issues of birth control, abortion, HIV, or sexually transmitted disease. Not. It is critical that test results and other protected health information blank be given to anyone other than the patient or a person designated as the patient's representative. ADA. Americans with Disabilities Act requires The ADA blank that communication procedures are available for persons with disabilities. Combined with APA requirements, this presents a challenging situation in dealing with patients who are deaf or hearing impaired. Alternative devices or services. Interpreters for individuals with a language problem, assistive hearing devices, note takers for individuals who have difficulty writing written materials, and so forth. Cannot. The cost of alternative devices or services blank be billed to the patient. Overhead. The expense of alternative devices or services must be charged against the blank of the clinic or practice. Required. Telephone service for hearing impaired patients is blank by the ADA. May use. Many hearing impaired, deaf, or speech impaired individuals blank a teletype or telecommunication device for the deaf. TTY and TDD. These devices transmit a keyed-in message via the telephone network just as a voice message would be sent if spoken. These devices are required at both ends of the conversation in order to communicate. ARU. Many hospitals and larger ambulatory care settings have blank telephone systems to manage heavy telephone traffic. Disadvantage. The blank with ARU systems is that the recorded voice may be difficult to hear, especially for older adults or hearing impaired patients. Favor. Many ambulatory care centers blank answering services because a live operator is reassuring to patients and other callers. VoIP. Blank calls can be made directly from a computer, a special blank phone, or a traditional telephone connected to a special adapter, any place having broadband connectivity. 3 types of VoIP. 1. Analog telephone adapter. 2. IP phone. 3. Computer. ATA. ALOLWS connection through a standard telephone using a computer or network connection. It is an analog to digital converter. IP phone. These specialized phones look just like normal telephones. They have an RJ45 Ethernet connector in place of the standard RJ11 telephone connectors. It connects directly to the cable router with all the hardware and software included. Computer. This was the original VoIP form of telecommunication. Disadvantages of VoIP. Most VoIP services ought not work during power outages. Emergency services through 911 may not be available. Directory assistance/white page listings may not be available. Fax are common in the ambulatory care settings as they are used to send reports, referrals, insurance approvals, and informal correspondence. Subject. The blank line should be brief and clearly identify the content of the email body. Re. Shorthand for regarding. Time critical. If the message is blank starting with urgent is appropriate. BCC. Shorthand for blind copy. Does not. Sending a BCC or blind copy also protects the privacy of your email because it blank show to whom else the message was sent. Flame. Do not send blank emails, that is, insulting message designed to cause pain, as when someone gets burned. Filed. Clinical emails to or from patients should be treated the same as telephone messages or letters. That means they should be printed out and blank in the chart. Interactive video conferencing. Blank consultation permits providers at remote locations to practice telemedicine and avail themselves of the services of a specialist at a large medical center, university, or teaching hospital. Voice alerts. The message is automatically heard by the person being paged. Beep alerts. The pager emits a beeping sound or silent vibration that notifies the person being paged to call a designated phone number to obtain the message. Alphanumeric display. It displays the message on a digital screen on the pager. Numeric display. It displays the callback telephone number on small screen pagers. Primary purposes of medical records. R. State statutes have ruled that medical records belong the property of those who create them. Patient. The information within the medical record belongs to the blank, and that information is always to be protected with the utmost privacy and confidentiality. Advantages. Blank of manual medical records, currently established and understood, easier to protect confidentiality, no worry of computer malfunction. Disadvantages. Blank of manual medical records can be used by only one person at a time, easily misplaced or misfilled, equipment and storage space required, more susceptible to error. Electronic medical. Disadvantage of blank records, needs protection to prevent loss of data, expensive to establish and maintain, may require on-site assistance, can require up to 12 weeks for staff to prove productive. Court. The standard in blank is that if there is no record of not piece of information related to a patient and that patient's care and treatment, then it did not happen. Must. You blank document all medical treatment. Ask yourself, does this relate to the patient's care and should it be in the chart? Correcting medical records. Draw a single line using a red ink pen through the error, make the correction, write core or correction above the area corrected, and indicate your initials and the current date. Strict chronology. Using blank, data are filed strictly with the most recently charted materials to the top of the folder. 3 TPS of file cabinets. Vertical, lateral, and movable. Vertical files are cabinets that have pull-out drawers where files are stored. Files are retrieved by lifting the appropriate file up and out. Rod and guides. These help keep file folders from slipping down underneath old file folders and getting misplaced or lost. Lateral files. These open shelf file cabinets make quick retrieval of files possible. The records are retrieved by pulling them out laterally from the shelf. These cabinets are the most popular manual patient record system. Movable file units. Allow easy access to large record systems and require less space than vertical or lateral files. Might be electrically powdered to move on floor tracks or may be physically moved with an easy-to-turn handle mechanism. File folders are designed for different types of labels. Extending along the top edge are tabs that are cut in varying sizes and positions to allow for different methods of labeling. Identification labels is adhered either along the top of the file folder in vertical file cabinets or along the side of the file folder in lateral file cabinets. Guides are used to separate file folders, are somewhat larger than file folders and are of heavier stock and are used in vertical and lateral systems. Single captions contain just one letter, number, or unit A, B, C, D. Double captions contain a double notation to denote a range of files, FB, Kodai, Hola. Alphabetizing is the key to organizing all files and charts. AMRA, Association of Medical Records Administrators. Unit identifies each part of a name. Legal name. When working in a medical setting with patient charts, the patient's blank is always used for the chart rather than a nickname or abbreviation. 9 rules of filing patient charts. Rule 1. Rule example, Cma Rma Carrera is filed as Carrera Cma Rma. Rule 2. Rule example, J. Larson or James R. Larson is filed in the following order. 1. Larson J. Larson James R. Rule 3. Rule example, Gerald Stephen St. Simon is filed as Simon Gerald Stephen. Rule 4. Rule example, Dr. Marlene Elaine Smith is filed as Smith Marlene Elaine Drive. Rule 5. Rule example, Adele Marie Johnson Smith is filed as Johnson Smith Adele Marie. Rule 6. Rule example, Amy Sue Sung is filed as Sung Annie Sue Mrs. John. Rule 7. Rule example, James Edward Brown Jr. and James Edward Brown Sr. is filed in the following order. 1. Brown James Edward Jr. 2. Brown James Ewart Sr. Rule 8. Rule example, Mosh Mabud McDonald Matsuti McCaff. Rule 9. Rule example, Edward Lee Klitka 4 is filed before Edward Lee Klitka Jr. George Lee Curtis 2 was filed before George Lee Curtis Sr. Address. When names are identical, the blank may be used to order files. Address indexing is indexed by city, state, street name, address. Preferred blank indexing methods include date of birth or social security number. Inspect. Carefully blank the report to identify the patient, subject, or file to whom the information belongs. Remove clips and staples. Make certain the information is complete. Indexing. Use the blank process to determine how the chart would be located, properly identifying blank units and their order. Coding. Sort. If there are a number of RPORTS documents to be filed, them into units according to the captions on the charts. This will eliminate wasted time in working back and forth through the alphabet or numbers. File. Once you have the paperwork sorted, it is time to blank them. Make sure the papers are placed in the proper charts and the charts returned to their proper place in the medical records section. 3 major filing systems. Alphabetic, numeric, subject. Color coding is a technique often used in the 3 major filing systems. It may seem complicated at first, but once MAs understand the principles behind it and practice its application a number of times, the task becomes much easier and there is immediate recognition if a chart is misfilled. Tab Alpha System. The various forms of the are designed primarily for filing systems in small offices that use vertical files where all individual charts are clearly visible in one unit. Each alphabetic letter is assigned a different color. Each folder has a color-coded label. Only full-cut folders are used. Alpha Z System. Alphabetic filing. Strict blank is one of the simplest filing methods, as files are strictly maintained by assigning a label to each file. Numeric filing. Blank is organized by number rather than by letter. A key benefit to this kind of filing is that it preserves patient confidentiality because the individual's name is not obviously apparent on the file folder. Straight numeric. Blank filing places charts in exact chronological order according to assigned number. For example, records numbered 45,023, 45,024, and 45,025 will be in consecutive order on a shelf. Terminal digit. Middle digit. In blank systems, the staff still files according to pairs of digits, but the pairs of digits are in different position. The middle pair of digits is primary, the pair of digits to the left is secondary, and the pair of digits on the right is third. 4. Blank essential components are used with a numeric system, whether it is a manual or computerized system. serially. Blank number dividers is guides. Consecutive numeric guides separate the individual file folders into smaller groups of files. Miscellaneous. Blank numeric file section. This is reserved for records that have not been assigned numbers. Patients should automatically be assigned a number on the first visit. However, on occasion patients cannot be assigned a number initially. Alphabetic card file. This alphabetic file is necessary as a source to locate numeric files or records. A card contains name, address, and file number. Any cross-reference is here rather than in the numeric files. 4 steps for cross-referencing. Release marks. It is a good practice to use some type of blank on every item that is filed. Ideally, the provider should initial the document after it has been read. Clinical notes include documentation such as the medical history, the physical examination, and the follow-up notes. They track the patient's course of treatment. Laboratory reports. X-ray reports, CT scans, ultrasound reports, blood work, urinalysis, EEGs, ECGs, physical therapy-related reports, and pathology reports. Information related to clinical data that assess the patient's condition. Miscellaneous category includes insurance-related papers, requests or transfer of medical records, and personal notes from to patients. Encompasses matters not related to direct treatment. Record purging requires sorting through records and removing those not in active use. Active files include records that need to be readily accessible for retrieval of information. Inactive files consist of records that need to be retained for possible retrieval of information. Files not currently being accessed for information. Closed files are those that are no longer required. Again, patient files are retained for significantly longer periods of time because of litigation and research considerations, usually 3 to 6 years beyond the statute of limitations. Aliquot part of the whole specimen that has been taken off for use or storage. Anticoagulant chemical in a blood tube that prevent the clotting of the blood by removing the calcium from the blood or by stopping the formation of thrombin. Buffy coat layer of white blood cells and platelets that forms at the interface between the plasma and red blood cells in a tube of blood containing an anticoagulant. Cannula the blunting member in a bioplexus puncture guard needle. Centrifuge device that spins tubes using centrifugal force to separate the fluid portion of blood from the formed elements. Constrict to become smaller in diameter. Dilate to enlarge in diameter. Edematous abnormal accumulation of fluid in the tissues resulting in swelling. Hematoma accumulation of blood around the venipuncture site during or after venipuncture caused by the leakage of blood from where the needle punctured the vein. Lipemia excessive amount of fat in the blood resulting in a blood sample that has a milky appearance. Palpate to search for a vein using the fingertips with a pressure and release touch. Phlebotomy process of collecting blood. Primary container that directly contains the specimen. Serum liquid portion of blood obtained after blood has been allowed to clot. Thixotrophic separator gel material capable of forming an interface between the cells and fluid portion of the blood as a result of centrifugation. Tourniquet device used to facilitate vein prominence. Viscosity degree of thickness of a liquid. Hemolysis. Rupturing of the red blood cells during the process of blood collection. The serum on plasma becomes contaminates and has a reddish color. Hypoglycemia. Increased levels of blood glucose does not mean diabetic but may be an indication of prediabetics. How long can tourniquets stay on arm? 60 seconds. Which tubes contain anticoagulants? Light blue, lavender and green. Most common type of venipuncture. Vacuum tube. Where are red blood cells produced? Bone marrow. What does SST stand for? Strain-specific typing. What is the controversy over with plastic adapters holders? If they are reusable after disinfecting. MA responsibility with phlebotomy. Collect blood as efficiently as possible, show concern for patients and provide high-quality care. What should MA show toward patients? Concern. How should MA collect blood? As efficiently as possible. How do you know what anticoagulants or additives are in the tube? By the color of the stopper. Why are additives used in tubes? To accelerate specimen processing. What must be done to ensure quality control? Each specimen has own label, label complete, no needle attached, appropriate tube, full tube, free of hemolysis. Each specimen must have own label. Label must have completed. Patient name, birth date, the date and time of venipuncture, ID number and MA initials. On pre-printed label tube the MA must still add date and time of collection and their initials. What percentage must have blood to be a full container? 75%. What percentage in a coagulation study tube must have blood to be a full container? 90%. Phlebotomy tray that is transported must have what? Label indicating biohazard. Order of site selection. AC, forearm, back of hand, wrist, and then with drive, permission foot. AC means antecubital. Where's the antecubital space? Opposite of elbow, in bend of arm. Other than foot, what site selection did we not practice on and what number is it in the order of selection? Wrist, 4. Forearm falls where in the order of site collection? Second. Back of hand falls where in the order of site collection? Third. What do we call the system that combines with either the syringe or the evacuated tube? Butterfly collection system. What is the usual capillary puncture site for adults? Finger, normally ring or index. What is the most important step to a successful venipuncture? Put the patient at ease. Why do we use safety needles? To prevent accidental needle stick. What is first step in the proper method to palpate a vein? Identify patient and introduce yourself. What do you do right before applying tourniquet when following the proper method to palpate? Wash hands. When using method to palpate after you apply tourniquet, what may you have patient do? Make a fist. When palpating, what are you feeling with? Tip of index finger. When palpating, what are you feeling for? Soft, bouncy and roundness of vein. Last 2 steps of the proper method to palpate a vein. Mentally map and remove tourniquet. What are you mentally mapping? Location of intended puncture. What is the 3rd step in the proper method to palpate a vein? Apply tourniquet. What starts with introducing yourself and identifying patient and ends with removing the tourniquet? What is proper method to palpate a vein? List some factors that can affect laboratory values. Alcohol, not dry, diurnal rhythm, exercise, fasting or non-fasting, hemolysis, hemoconcentratio, insufficient volume of specimen. Hemoconcentratio. Tourniquet on too long. Diurnal rhythm. Timed intervals because of medication or daily rhythm. Hemolysis, known as destruction of blood cells. What is the usual cause of hemolysis? Alcohol not completely dry at site of puncture. How many liters of blood are in the body? 6. What is the functions of blood? To carry oxygen to the body tissues, remove waste product and to carry nutrients to all parts of body. Name one waste product that the blood carries. Carbon dioxide. Method for capillary blood draws. Select site, gather equipment, cleanse site, perform capillary puncture, wipe away the first drop of blood, collect the following drops of blood for specimen. After capillary puncture, before wiping away the first drop of blood, what must be done? Discard lancet in sharps container. Why wipe away first drop of blood? It contains tissue fluid which dilutes blood. What do you use to wipe away the first drop of blood? Dry, sterile gauze. When selecting site, which part of finger is used? Alongside, not across finger. What is the final step in serum formation? The clot contracts and the serum is extracted. Serum formation is known as clotting. What is the usual site of capillary puncture in infants? Heel stick. What should the medical assistant do if you have attempted venipuncture twice and are unsuccessful? Notify the physician of your attempts. What is the correct order of draw for evacuated tubes? Yellow, light blue, red tiger, green, lavender and gray. What separates the red blood cells from the plasma in anticoagulant tubes? Buffy coat. Which type of blood cells are responsible for transporting oxygen and carbon dioxide? Red blood cells. What are some advantages of using latex tourniquet versus Velcro strips? Latex can be cleaned easily and are less expensive to replace. When would the syringe be the most often used technique in venipuncture? When a small volume of blood is needed and only thin fragile surface veins are accessible. What information must be on the specimen tube label? Patient name, patient birth date, patient ID number, date and time drawn, and MA signature. What is the appropriate degree to inflate the BP cuff to when using a tourniquet? Slightly below diastolic pressure. When using a BP cuff as a tourniquet, what extra step is required? Blood pressure must be taken first to find the patient's diastolic pressure. What color tube is used for a CBC? Lavender. A lavender tube has EDTA. Proper technique for applying a tourniquet has it placed where? 3 to 4 inches above intended puncture site. For patient comfort, the tourniquet can be placed over clothing or gauze. What is removed before removing needle from a puncture site? Tourniquet.